Good morning. It's Monday. Feels like a Monday. Thank you all for being our partners in trying to be as communicative as possible with the public as we move through the coronavirus epidemic here in our community. As always, I'd like to thank Jay Gates for interpreting this morning. We had a lot going on this weekend, and I just do want to mention that I went out to the funeral service for Officer Gates in Springdale. Police Chief Wells was generous enough to invite me to the service. I stood outside. There was a lot of social distancing obviously going on. But I think it was a stark reminder of how important our first responders are in this community, how so much of what they do puts them in danger and harm's way, and how grateful we need to continue to be to our first responders. We have first responders with us this morning, and so I just do want to acknowledge that it was a very sobering ceremony and a real reminder of how a woman, police officer, Officer Grant, just doing her job, put her in harm's way and had a fatal ending. So it was just really challenging. I do want to also say our condolences are with the family and the police officers in Springdale. Many other jurisdictions have stepped up and are filling the shifts of so many of those police officers that needed some time off or needed to prepare for the funeral. So anyway, it was, it's both the good and the bad. It's in times like that. So we're going to start with the numbers, as we always do. As of this morning, I talked to Greg Kesterman, as I always do in the morning. We have 85 confirmed positive cases in Hamilton County of COVID-19. You know where we left off? Good morning. It's Monday. Feels like a Monday. Developed for how our first responders will be dealing with 911 calls, particularly emergency room visits. It is important to have this set to give a clear guidance to our frontline workers to deliver on how to assess and react to the multitude of scenarios that they will face. It's also key that the public understands this. Safety will remain paramount, but what that looks like, sorry, Jay, will be different than what people are used to. So a couple things before we get to the folks that are going to speak this morning. We took some action at our county commission meeting related to 911. So as you know, we have a very robust coordinated system in Hamilton County for 911. Andy Knapp is the director of our comms department. That is the department that deals with 911. And he came to us with a request for some equipment that allows the 911 operators to spread out. So Right now, they're all in the same location on the same equipment, and it's close quarters. And so the ability to get more equipment to have them operate remotely at a different facility has become paramount at this time. And so, in order to do that, we needed to pass some authority to purchase that equipment. It was just over $100,000. Our administrator doesn't have the capacity to provide that funding over $100,000. And so we provided the administrator with the authority to go above that to $250,000. But I think it's a really good example of why at this moment in time we all need to be somewhat nimble in our responses and allow for some flexibility, particularly for the county administrator in this case, to buy equipment we know is necessary at this time to make sure 911 continues to operate as it has been throughout Hamilton County, but also keeping those employees safe. So I think it illuminates some of what we're trying to accomplish in Hamilton County. So we're going to call in 1 second on Andy Knapp, the director of Hamilton County Comms Center. Paul Gallo is here. He's the assistant fire chief from the Reading Fire Department. And we also have Dr. Woods Curry from UC Health. They were helpful in trying to put together a protocol for the first responders in Hamilton County. And my understanding that this is around all 49 jurisdictions. And so the protocol that has been worked through and worked on by first responders and UC Health is available for the first responders as we move through the epidemic. Couple things before we go to the speakers. We've talked about the Justice Center. We had the sheriff in here last week talking about capacity. And remember, he is trying to get down to a number where we have one individual per cell so that we can practice that social distancing in the Justice Center. And so we are down to 877 inmates. That's down 379 from, I believe, earlier this month. And so I think we're very close to that number. I will get updated numbers tomorrow, but that's good news as we try to distance the folks in that facility. Obviously, nonviolent offenders are the ones that are being released so that they can be monitored in the community. Also, one other thing, we're hearing a lot about budgets right now. We've heard about the stimulus package that's coming down from the federal government. You've heard from some of the local jurisdictions about some of the funding challenges that we face. And so the county is no different than these other jurisdictions. And so I want to let folks know that we are likely to have Jeff Aludo, the county administrator, come in later this week to talk a little bit about some of the strains on the county budget. Remember, our budget relies primarily on property tax and sales tax. Sales tax is down. Sales tax is down everywhere. And so there will be a negative impact there. Our hotel revenues are down. Our parking revenues are down. And so at a time when we were starting to kind of get our feet and to stabilize things in Hamilton County, we are now taking a hit because of the coronavirus. And so there is a lot of modeling going on. We're trying to be predictive when it comes to what things might look like if sales down or sales tax is reduced to this amount or this amount, And so I think it would be helpful to have Jeff in and talk about what we're doing at the county to try to respond to what we know is coming, which is reduced revenue. And what the options are, what we can do to respond to that. So that will be later on this week. Also, just a reminder that Greg Kesterman, the county health commissioner, will be here tomorrow. We're going to try to get him in once a week at least to talk about what he's seeing on the ground and some of the numbers and what those numbers reflect. So with that, I'm going to turn it over to Andy Knapp, our comms director, and let him take it from here.
Thank you, Commissioner, and good morning to everyone. I appreciate the opportunity to speak to you and give you a little bit of an update of what's going on in the 911 system for the county. The men and women that work at the County Communication Center take their job very seriously, and certainly it's times like this that we hate to say we've trained for this and we know what we're doing, but we want to extend that air of confidence in the systems that we have to the citizens throughout Hamilton County. And the three PSAPs, or public safety answering points, that handle 911 traffic from everyone which would be the Hamilton County Communication Center, the Cincinnati Emergency Communication Center, and then the Norwood 911 Center. Having said that, we've implemented some things at our center specifically to try to minimize the impact of our essential workers. Our workers obviously have to show up for work. They have to remain healthy in order to continue to serve the needs of the citizens. And we're doing the best we can to try to keep our workers as healthy as possible. We've implemented some changes where normally we allow civic groups, we allow tours, we allow observers of other first responders as new police officers, new firefighters come on duty. We like them to see the dispatch center. We've stopped all of that. We've limited our staff as much as possible. Only essential personnel are allowed within the building. And we're hoping in that social distancing that we're implementing as well, that will continue to function for us to keep us as healthy as possible. We've also taken the opportunity to reinforce our continuity of operations planning. And what we've done is gone through our staffing levels, make sure that we have adequate staff to handle the incoming 911 traffic and the radio dispatching that's necessary to be safe and effective. We work with our communications officers union, for example, and we have some emergency contingency plans in place should our staffing levels dip below an acceptable level. The goal is that we continue to serve our mission regardless of our staffing level, and so our employees know that we are going to have to kick in if we need to just bump up our workforce. We're doing like everyone is doing now, a weekly video conferencing, and actually we're doing it twice a week, opposite of when the county management team is getting together to try to implement as many changes that are going on, not just in the administrative world, but also to serve the needs of our first responders. As you can imagine, there's a lot of things that are changing, that we're seeing change, that has to change and has to change quickly for us to be effective and keep our workforce safe. Working with the commissioners and with county administration, we are securing necessary backup equipment, as Commissioner Dreihaus indicated. This backup equipment it's something that we've needed for quite some time, but it's needed even more now as a result of our workforce needing to stay safe. We'd like to be able to separate our workforce so that we don't have all of our personnel within the same confines in the same area of the building, and being able to go somewhere else and actually separate our staff into two separate work groups is a plan that we're looking at to try to find creative ways of continuing the 911 operations as best we can under these conditions. So we talk about conditions. Our current conditions, we notice actually a decrease in the 911 traffic coming into our center. We believe that this has to do with the social distancing. We believe that the people are taking this message seriously, and so with the reduced traffic on the roads, with the reduced workers going to work, that we've actually seen a slight reduction in our 911 call volume. But we also fear that this may be the lull before the storm, if you will, and so we continue to monitor very closely and stay in touch with our police and firefighter personnel, so that we make sure that we respond as we flatten the curve, and now as that curve perhaps starts to increase, we want to make sure that we're as responsive as possible to both the citizens and to the first responders. So with that, I will remind the general public, what can you do in these circumstances? And we always say that if you have a true emergency, please don't hesitate to call 911, and that's certainly the message that we would have now. If you are a person that is under medical observation, perhaps for the COVID-19, we suggest that rather than calling your 911 resources, that you call your own physician first. So really, we need to reserve and rather preserve the 911 system for the most life-threatening of symptoms and emergencies. And if you can, call your doctor. If you're looking for routine information about the disease, there are plenty of resources for you to be able to go to. The Ohio Department of Health has their 1-800 number that is available in general questions that you can ask of all places. Again, the 911 system is designed for emergency, life-threatening type of information. If you feel sick, call your family physician, your caregiver. If you have mild symptoms, do not go to the emergency room right away for a COVID-19 test. And that's something that Chief Gallo and Dr. Curry will talk about here shortly. But as far as the calling for the 911 system, life-threatening symptoms include symptoms such as shortness of breath, chest pains, a very high fever, an acute onset of cardiac issues, and dizziness or confusion. Um, when you do call 911, you can expect some additional questioning to be asked. This is something that has been going on since late January. To be honest with you, we're going to and this is on all 911 traffic. So if you're calling for a crime in progress, for example, we're still going to ask you, have you had contact with someone? Have you recently traveled? Are you in a household that has, a suspected or perhaps a tested COVID-19 patient? All of those things are being done in a manner to protect and preserve the health and welfare of our public safety responders. We're also going to probably give you some, in addition to our normal medical instructions that we would give you by telephone, we're going to ask you that when the first responders arrive, to please step outside, meet them outside if possible. Again, with social distancing, we all want to be considerate of that and be able to walk outside, meet the fire EMS personnel and or your police officers so that they're not in a confined space where perhaps we cross-contaminate each other. Again, keeping in mind that in most communities have a very limited amount of resources. Specifically, when you talk about fire and EMS, there's a very limited number of EMS units. So when we have one EMS crew that encounters a patient that has some type of uh, a symptom that you actually may be jeopardizing a large percentage of the responders for that entire community. So we're going to ask you to step outside. They may be wearing types of personal protection equipment that you may not have seen before, and don't let this alarm you. Even if you do not have the virus, we're still going to respond in that manner, and they're going to be in that equipment, and so be prepared for that. And then be aware that 911 and EMS services only transport to hospitals. We do not do routine transport to doctor's offices or urgent care centers. You're going to be transported to an emergency room, and that emergency room has a very limited amount of resources that again, my Chief Gallo will talk about here in just a little bit. So with that, I appreciate the time to give you a quick update. I want the public to have the confidence in the 911 systems throughout Hamilton County and the 3 911 centers that handle the 911 traffic for you, to know that we're prepared. We're looking to see what changes we need to make in order to continue to be effective. And we're there for you. There should be nothing but the utmost of confidence within our systems. And for that, I appreciate it.
Thank you. And as you all know, what we're talking about today is what we're seeing on the ground right now, but also in anticipation of the surge that we've been hearing about, which, we've got time frames under which we might experience a surge. And so we need to be ready when it comes to emergency response on the ground. And so that's what we're referring to here. So I'm going to call up Chief Gallo to give us an idea of the partnership here amongst all the first responders throughout the county and their involvement in establishing and kind of creating this protocol that will best serve them as we see the situation progress.
Thank you, Commissioner. In Southwest Ohio, we have a protocol committee that meets every year, 6 to 7 times a year. It's made up of Hamilton County departments, Northern Kentucky departments, numerous doctors from various hospitals, and EMS coordinators. We develop protocols usually that we implement once a year. However, this year, because of the pandemic, we've come into an issue that we got to address, and that is making our resources available for emergencies. What we have found, in much of the statistics show that 80% of the people do just fine. However, there are some of the individuals that come down with the COVID-19 that might experience serious illness and need to be transported to hospital. But we want to try to limit the amount of people that we send with minor symptoms to the hospital. We were contacted by some various people on the committee looking to see if we were going to develop a protocol. We started the process, and granted, this is an unusual process for us. So we developed a protocol, we sent it out, it got approved by the numerous departments that are involved in this protocol, and it was sent to the EDS committee, which approved it, which oversees the Southwest Ohio Pre-Hospital Care, the protocol committee. The goal of this protocol is to try to keep our resources available, like Director Knapp had mentioned. If we can decrease the number of people that we're sending to the hospital and keep our resources available, because there will be other emergencies going on. People will have heart attacks, they'll have strokes, people injured in falls. We got to be able to take care of those people. So if we can limit the number of transports we're making and be available for those calls, that was the idea behind it. The other possible goal is we decrease the surge on the hospitals so they can take care of the sickest people. The other thing is if we send minor complaints to a hospital with, and they could be potentially exposed to worse conditions, which they could also then become worse also. If we do not transport you to the hospital, we will provide a home care packet that will be handed off to you. It'll give you instructions on what to do, such as follow up with your doctor and to treat it like any other respiratory illness that you might have. It does not mean that you can't call 911 back and have us respond back, especially if you develop shortness of breath, symptoms become worse. We will come back, and yes, we will transport you to the hospital. So again, it's new for us in this area, especially developing a protocol of this type. Hopefully that answers some of your questions.
Thank you, Chief Gallo. And so Dr. Woods-Curry is going to come up and expand a little bit about the protocol that is going to be put in place.
Thank you, Commissioner. So just to speak a little bit more about the protocol process and the protocol itself. So the Southwest Ohio Protocol Committee is a subcommittee of the Emergency and Disaster Services Committee of the Academy of Medicine of Cincinnati. So it's a well-established committee. We, as Chief Gallo said, usually put new protocol updates out once a year for the Southwest Ohio region. Northern Kentucky has started to use many of our protocols and participate in our process. It's a very robust process. Normally, we take a very long amount of time to make the protocols and lots of discussion, and obviously this required a much shorter process. We looked at protocols throughout the entire country. There are many other jurisdictions and cities that are being hit on the front wave of this faster than us that are implementing these protocols. We took dozens of those together and used that as the matrix and framework to develop this protocol. The protocol is evidence-based. People with significant comorbidities or and those are diseases that predict that you will do poorly, or abnormal vital signs get excluded from our non-transport protocol. We want to assure everyone that if you call 911 for these symptoms and the paramedics come out and evaluate you, and you meet all the criteria to not be transported to the hospital, that it's probably safer for you to stay at home. You are probably at that point in the group of people who are going to do well. You certainly don't feel well. The patients that I've seen in my emergency department that have coronavirus don't feel well. But if you have reassuring vital signs and you're not in the risk categories that predict that you will do poorly, most people will recover and do better more safely at home. We very much want to make sure that every citizen is cared for. So as Chief Gallo said, if you meet the criteria for doing more poorly, or if you feel that you're just not okay to be at home anymore, you can always call 911. We want to preserve the 911 system for everyone that calls to be evaluated. You'll get a sheet of home care instructions. It's got a link. You can go onto the CDC website and look at their kind of videos and things. But just be sure that this is a thorough and vetted process. It's different than what we normally do. Almost all of our other protocols, if you call 911, you're always going to be transported to the hospital. So this is a little bit different, but We do think that it's the right thing to do in this particular situation, and I'm happy to take any more.
Thank you. And once again, thank you so much for the work that you're doing in collaboration with one another, the medical community, the first responders coming together to try to figure out how to behave in a responsible way during what we anticipate, which is the surge that is coming. I applaud you for having the protocols in place. And I didn't know you all met on a regular basis. So that is very helpful as now you come together in a moment of crisis because you've already established the relationship. So thank you for all that you're doing. Oh, I wanted to mention one other. I know I had a moment. I wanted to mention one other thing. So over the weekend, as happens during the week, people are constantly emailing and texting offers for PPE, for supplies, for spaces that could be made available for not only people who need medical treatment, for the homeless community, and for the first responders, which is something I think that is now starting to pop up on the radar, where we have first responders or individuals that work in a hospital setting that aren't comfortable going home because they're afraid they're going to convey the virus to their families. And so we're working on all fronts, trying to figure out what that looks like in conjunction with the city, the county, and all the first responders in this community. So it's a collective effort, and I do want to thank everyone that's involved in making sure that we are as ready as we possibly can be throughout the next couple of weeks. So with that, Bridget, I think we're available for questions.
Yes, I think we're going to go to Todd Dykes from his iPhone from Channel 5 first.
Morning.
All right. Hi, Bridget. How are you doing? Hi, Denise. Good to see you both. Question, a couple come to mind, and I wanted to ask Andy if there's a way to quantify the number of 911 calls that have the decrease, if you will, for, say, the last couple of weeks. Is there a comparative period for last year? I'm just sort of curious how dramatic that drop has been. And then just a real quick follow-up, maybe to you, Denise, after Andy takes a shot at that one. Thank you, sir.
So thanks for the question, Todd. I have what I'm going to call anecdotal evidence. I get a report from our 911 system every night at just after midnight, and we normally average anywhere from 1,200 to 1,500 calls throughout the day just for our center. And what we're seeing is that, for example, I think it was Friday, we struggled to even hit 1,000 calls. So it's a slight decrease in percentage. And then, when the weather was really nice the other day, then, our calls went up just a little bit more. But overall, the general trend is that it's trending downward. What I'm actually looking forward to is the end of March, and then I'll compare where we are this March compared to last March, if that makes sense. But nonetheless, initial impressions and anecdotal impression, if you will, is that our calls are trending downward.
Okay, thank you. Again, a real quick follow-up, just while I've got you, and I know Scott is going to be next from the Inquirer. Denise, John London is working on the story about hospital beds, the potential for surge capacity, and so forth. What relationship does Greg with the county health department have with the health collaborative, with the various hospitals? I mean, do you have any exact? What are we thinking about on that front?
I don't have numbers. We did have the Health Collaborative in here last week, kind of generally talking about what they are doing to get ready for what we know is coming, right? It's an increase in capacity, particularly for hospital beds. And so remember that Sharonville has offered to open their convention center for capacity purposes. The city owns Duke Convention Center. Those conversations are ongoing. There's been some conversation about hotels. And so we are talking about it on all fronts. And so the health commissioner and the health collaborative are talking, throughout the week, at least every other day, because I'm on the calls every other day, probably more frequently than that, to talk about what we expect, is coming and what the capacity needs to look like. But I think it's important that the collaborative, which is all the hospital systems, by the way, coming together to figure out, generally speaking, what are we looking at and how do we collectively respond?
Next question is from Scott Wortman of the Inquirer.
Am I up? Hello? Can you hear? Oh, getting used to the new technology. Denise, Andy, thanks for taking the time. Can you hear me? For Andy Knapp, you mentioned that their surge, you have ill. Where would the additional 911 dispatchers come from?
So I heard part of your question, Scott. To be honest with you, the video kind of broke up a couple different times. But I think what I understood was, where would the additional 911 operators come from? If we were to suffer a loss to our workforce, and we've estimated that we could probably take a hit upwards of 35 to 40% of our total workforce. And keep in mind, my allotment of 911 operators is 68. I have an additional 10 supervisors. And then on top of that, there's about another 6 administrative personnel who, like myself, who've worked in the 911 industry for a number of years. All of us have beefed up our skills. We've honed our skills a little bit so that we could function as call takers if necessary. If we were to suffer any more of a loss of our workforce over the 40%, for example, then we're going to look at being creative with our schedules, and something that's not always popular, and that is canceling off time if we need to. We can rearrange our schedules to go from the current 8-hour a day schedule to a 12-hour schedule. And that would indirectly then increase our staffing personnel because we wouldn't need as many spots. So there's some creative things that we're looking at, steps that we've never implemented, but we've always had the contingency planning in the background just in the event that something such as this would happen. But right now, I think we're okay, and I hope that answered your question.
Scott, did you have a follow-up question from that?
Answers my questions. I didn't know if other people could be conscripted rapidly, but I guess come to it.
I think what I understand is can we quickly train other people to become 911 operators? The challenge is in the state of Ohio, there's a minimum training standard that is required in order to answer 911 traffic, and although we have 6 months to apply that. So, for example, a new employee comes on board. I have 6 months, according to the state of Ohio, to train that employee. We could certainly do the training, and we can actually be even more creative with our telephone system. An example is I can separate 911 traffic from regular administrative calls. So I think what we would probably do, rather than trying to bring outsiders in and get them up to speed quickly, would be to probably teach outsiders how to handle administrative type of calls and find a way to preserve the trained 911 operators for the true 911 calls, and just offload our non-emergency traffic onto persons that may not have as extensive experience as what we normally would have on board. Nonetheless, there's some creative thinking and some outside the box thinking. The women and men that work for us in the 911 industry, actually all across the state of Ohio, and we have the unusual benefit of being in a tri-state area. I've been in contact with directors from all 3 states, to be honest with you. And all of us are looking at creative ways to do this. And the staffing challenge, to be honest with you, is not a new one for us. These jobs are very difficult to fill. And although I would hesitate to say that now's the time that if you're interested in becoming a 911 operator to consider a career change, but nonetheless, at some point when we get out of this, the 911 industry is in desperate need of looking for personnel. There is a shortage across the nation. And we need very talented people who are dedicated and understand that it's a 24-hour day, 7-day-a-week job. It's a weekend, the holidays. It's not the easiest job in the world. You're talking to people on the absolute worst days of their life, and you're hearing things that you cannot unhear. And it's kind of like you say when you ring the bell, you can't unring it. There are things in my career that I've heard that still haunt me to this day, and this is something that the first responders, if you will, the 911 operators for our nation, they're up for the challenge. And so as I keep an ear on what's going on all around us, the shortage is there on a constant day-to-day basis, but also the resiliency of these people to find a way to fix things when there's no tools to do the fixing. It's been incredible. There's been an absolute wonderful response from our 911 professionals.
It appears that Scott Worman has a follow-up question for Commissioner Dreihaus.
Yes. Thanks, Denise. Wanted to see what the county is submitting, state are submitting the Governor DeWine's office report on enforcement of the stay-at-home order and non-essential businesses. Summit County has been really aggressive up in Akron, the Akron area, closing over 30 businesses. What does Hamilton County's report say on that?
So let me answer that question. But first of all, let me say to you, Andy, and to the 911 operators in the county, thank you for your service, because it is challenging. And I'm not sure we always think about that when we're calling 911 and the strain that we're putting on those individuals. So thank you for that. So Scott, stay-at-home order. This is one of my favorite topics. So as you know, the stay-at-home order is an order from the Ohio Department of Health. Dr. Acton, along with Governor DeWine, have put something in place, available on their website, available on our website for people to take a look at. It can be clear under some circumstances, but there are other circumstances where the stay-at-home order is being interpreted locally by public health and then enforced by public health and some of our local first responders and police departments. And so it has gotten a little muddled. And I think I spoke about this last week. What we are asking for is a statewide hotline so that the interpretation piece is left to the state from whence the report came. I feel like they are in the best position to interpret the order. Then the law enforcement piece falls to the locals. And obviously that needs to happen locally. But this interpretation part has gotten a little confusing because what has happened is that from one jurisdiction to the next, you've had a different interpretation about what should be open and what should be closed. And I know I've told you before that we're not only hearing from employers who are wondering if they're an essential service, should they remain open? We're also hearing from employees who feel as though they're in a workplace where they can't practice social distancing and they're at risk. And so we are trying to sort through this situation that, the city has their own health department, the county has their own health department. And so those calls are going to those jurisdictions. But this interpretation piece can get a little complicated. And so I was on the phone over the weekend again with the governor's office asking that they set up a state hotline so that the interpretation happens at the state level and the enforcement then happens at the local level. We are not there yet. The gentleman that I spoke with, who is with the DeWine administration, said that he would get back with me today. So if I don't hear from him, I'm likely to call him myself. But I've also reached out to, there's a strike force in Ohio. I've reached out to a gentleman on the strike force also. They're hearing this from all over the state. And so it's a concern. We just want to provide some continuity throughout all the jurisdictions in Ohio so they're all working from the same page. So that's where we are. It's an ongoing process. I remain hopeful unless I shouldn't be, and I've not heard yet that I shouldn't be. And so we're still working on it.
Just a quick follow-up, because it was my understanding that a report was submitted from the county. Is that true?
Aware of that. And I did check in with the health commissioner, and he's also not aware of that.
Okay. All right. So you don't have any figures on enforcement in Hamilton County or numbers of businesses closed or number of complaints or anything like that?
A little bit about that. And so the experience so far in Hamilton County has been that when they get a call in about an employer from either the employer or the employee, they go out to the facility or they do it over the phone and get a better understanding of what they're doing in that facility. And then they make a determination as to whether or not that business should open or stay open or close, or if there's something else they need to do in that facility to practice the social distancing and clean surfaces and that kind of thing. And so from my understanding, that work and the team that's doing that has not had to close anybody yet because they're working with these business owners and with the employees. Now, that said, I am not aware of all that's going on through the police departments in some of the jurisdictions in Hamilton County. So if you're in one of the jurisdictions where a police department has gone in and issued that order, I'm not aware of it. I can try to get that information, but when I spoke with the health commissioner, I believe it was on Friday or Saturday, he also was not aware of that because he's working with his own team. So that's where we are at this moment in time.
Okay, it appears Todd Dykes from Channel 5 has a couple follow-up questions.
Yes, Denise, I'll throw these your way. Has anyone at the county level had conversations with Kroger, for example, since there's such a giant presence in our area? We're hearing that some commercial stores, shopping center or stores are doing a pretty good job, or they're taking different tacks to keep people separated inside stores. And I'm wondering, since most of us shop at Kroger, or at least a lot of folks, that there are dialogues about trying to keep shoppers separated, limiting, how many people can be in a store at a time. Or are we at that stage yet, or are those conversations, have they happened?
I have not had that conversation with Kroger, although I know they are wiping down surfaces and trying to be diligent about the spacing. Home Depot also has, from what I understand, X's on the floor when you're both going into the store and when you're standing in line for checkout. And so there are some stores that are taking that very seriously and literally prescribing where you can stand. But I haven't been to a Kroger in the last few days, and so I can't comment. But I do have a contact over there. I'm happy to follow up and get you the answer to that question. Kroger, by the way, has been a terrific partner through all of this. They're very accessible, they're very available, and I know they're doing all they can, especially related to hoarding issues and trying to make sure that, because what we know is the food supply chain is strong, but when people are hoarding, that's when you see those empty shelves. That is not because there's not food available. That's because people are buying too much stuff at one time. And so they are trying now to control that and respond to some of the concerns that we're hearing throughout the community.
And I'll give Kroger some credit. I went to the pharmacy in my local Kroger store last week, and they had the spacing markers down. And in fact, I got too close to the person in front of me, and she politely asked me to step back. So I did. It was it was not in that mindset. Quick question for you. Two more real quickly. Census. A lot of people have census surveys. Deadline is Wednesday. I've been looking online trying to understand. It sounds like field operations have been suspended for a couple of weeks. I know that's at the federal level, but to you, do you have any advice for people here in Hamilton County that might be concerned that they don't know if they should do this? They obviously do the survey if you can now, but if they've delayed, what do you say to those folks?
Remember how important the census is to this community. When we talk about federal relief, especially in the situation that we're in right now, all of the benefits and all of the relief that we get is related to the population in Hamilton County and in the city of Cincinnati. If we don't have good numbers, we are not getting our fair share of those dollars, and they're going somewhere else. And so last time in the county, our response rate was in the high 70s, and in the city, it was around 70%. We need to do better because we are leaving resources on the table. And they're both for kind of the safety net, but they're also economic development dollars in different times. And so I can't emphasize enough how important it is that everybody gets counted. We need to have everybody counted. And so my advice would be either get on your computer and respond via the internet, or return the census form in the mail so no one will come to your door, because it's the person comes to the door only when there has been no response. And so if you don't want somebody standing at your door, respond. Go online or mail it in. You're also referring to the workers, the census workers, and there are many that have signed up to help with the effort, particularly in Hamilton County. And so I know there's been a delay there because they're worried about, obviously, the close interaction. I don't have the time frame for that, but there is clear advice about responding to the census ASAP so that we don't need to send somebody out to the door.
Thank you. And final question, Denise, while I've got you, last one, I'll defer to Scott or whomever. PPEs, we're hearing so much about them. That is clearly top of mind subject for all of us. The availability of gear for hospital workers in our area. Where does that stand from your vantage point? Does Greg have a handle on that too at the health department? What's going on with the PPE front?
So I listened to the governor's press conference yesterday about his efforts with the president to try to free up technology that will expand that capacity. So I applaud the governor for doing that. It's just really important that we take advantage of all the technology and resources, particularly in the state of Ohio. I do want to say, though, beyond that, what we think we know is that when a surge comes, and correct me, doctor, if I'm wrong, we are concerned about a shortage of PPE. And it's not only in the hospital setting, it's also for first responders. And we just heard about how first responders are taking precautions when they go out on a run. You know, you're talking with someone outside, hopefully, but not always. And so the first responders need the PPE as well, in addition to folks in nursing homes, and the list goes on. And so we're trying to prioritize where the needs are and expand capacity. The more time we have before the surge hits, the better off we are. So that's our moment in time right now, flattening the curve, all that stuff we've been talking about for weeks now. That's part of the strategy. And so what I can tell you is that I personally have been contacted by individuals throughout the community who have access to PPE, whether it's masks or gloves or gowns. And so they're offering support. Sometimes it's international support so that we get those materials from outside the United States, because obviously there's a high demand throughout the country. So we're pursuing all of that, and primarily through emergency management, coordinating kind of all the emergency response, also through the health collaborative, coordinating the hospital response, and also through the business community. Because I just got one over the weekend where someone was talking about 3D printers and how a 3D printer can, forgive me, I'm not that tech savvy, but it can create a mask that is plastic, and it can also serve as a protective gear. And so a lot of people have 3D printers throughout the community. And so now the business community has gotten involved to say, where are the 3D printers, and can we get them what they need to produce these 3D masks? And so there is so much going on in the space of PPE because the need is going to be so great. So right now, I think we're fairly stable. Am I right, doctor, when it comes to these supplies? He's giving me a nod. But we know we're going to need more. And so that's where we are. But there are lots and lots of efforts.
Appears to conclude.
Hey, once again, I want to thank you all. You can't see them, but you all were really fantastic. Thank you for the work that you're doing. So appreciate the cooperation between the university, first responders, communications department. Yeah, I think the message, the takeaway today is call 911 if you need to. They'll do an evaluation, and then if you need to be transported to the hospital, you will be. And if you're more safe at home, then that will be the course of action. So again, thank you. We'll have the health commissioner on tomorrow. Stay safe. Thank you.